some of you, I mean, all look good, but some of you are doing more lifting than what you need to do. So what I would do is I'd bring my patient forward, and I'm stepping here so I don't bring too much forward and they end up on the floor. And then as I get in here, I'm putting my chin on the back of their shoulder. So I'm getting them into flexion. And once I get them into flexion, I can make that momentum, pick up their hips, and make that pivot. Some of you are just doing too much lifting. It's not necessary. Okay? And if you don't have your patient, you don't have them flexed, this makes it a whole lot more difficult to use that momentum and make that transfer. Okay? So get them in there, get them leaning. 1, 2, and pull and pivot. That's hardly anything on my back. All right, good. Now the other thing is, some of you brought up some good points. What about a chair that doesn't have removable arms? Yeah, that's the real world. You got a barrier. You got an extra barrier that you're going to have to deal with. In that case, you're probably going to want to get those hips shifted forward as much as you can without dropping them on the floor, so that you're not dealing with that arm as much as you need to be. Especially if you got a max transfer. If you got a mid or moderate, it doesn't really matter. If you got a max and they're in a chair that is a chair that doesn't have any removable features to it, a little extra, some extra barriers there. And maybe that might be your patient in a medical setting like a skilled nursing facility or hospital. That might be the patient that does occupy a chair with removable features. So, what are the good things about chairs with removable features? Just that. They remove, and you can take away the barriers, where the cons are more expensive. What are the features of chairs that are your institutionalized chairs, right? You can't take anything off them. They got footrests that don't come off, all of yours are off. They're fixed. They have armrests that are fixed. Nothing comes off of it. What's the drawback to that from obviously a functional standpoint? Exactly what we just mentioned. What's pro for that though? It's less expensive, and what else? What have you all noticed about these features that come off of these chairs? Some of you have chairs that the armrests are put on wrong. Some of you might have got a chair and maybe there's not a leg rest on it. What do you think happens in healthcare facilities? Do you think those parts are lost a lot? They are. Okay, so that's the downfall of them. So if you get a chair that doesn't have stuff that comes off, it's not coming off. You're going to have a pretty full functional chair. It's frustrating though. The leg rests get left down into physical therapy, or they get left in the bathroom, and this part got interchanged with this patient's chair part. There's the drawback to that. And you guys might be in situations someday where you're ordering masses of chairs for X, Y, and Z skilled nursing center. You know, you're going to have to determine based on your budget what kind of chairs do you want. All right, so that will